The mentality that we as the medical direction cadre have adopted is, and realistically it was this way before, but of course, the hospital politics trickle down, and you have to have you have to tell your crews to bring the patient to this facility for this thing, and so on and so forth. And now that we have a subspecialty recognized under the American Board of Emergency Medicine, we have now gotten the power to fight back and say, I don't care what you want for the hospital system, because this is what's best for the patient. We have these resources available at this facility, and what you're telling us to do, because we're affiliated with you and not that hospital system, despite the fact that we're providing oversight for an agency that services the entire city, county, whatever, you're telling us to bypass a facility that has the ability to provide care for this patient in order for us to bring the patient to your facility because you want that payout, whether or not that's the actual motivation, but that's just kind of the
right.
So we have adopted this mentality of, when we're operating in the out of hospital setting, when we're providing that oversight, we are acting as agents of the agency, of the fire department, of the ambulance company. We are understanding, I will say, of the requests of the various hospital systems, but it's about the patient, not about the paycheck. Because at least for us EMS physicians, we don't do this for the money, right? We could have gone into other areas, but this is the passion that, EMS physicians don't, we go into it with the understanding that we're dealing with a model that is not lucrative, that has regular budget cuts and constraints that are placed by the state, by the city, by the county, so on and so forth. We do it because it's the mission as opposed to anything else.